Lives are still on the line in here, and there's no room for complacency. But the sight, at last, of some free beds in the Monklands Hospital ICU is the light at the end of the tunnel. Staff are past the peak of coronavirus, at least for now.
It's not as bad as it was at the start. The first couple of weeks were pretty horrendous. We were ventilating like 15 patients. Our unit was full. We were ventilating patients through here. And we did have that kind of lull, but now it kind of feels, I would say it feels like it's getting a bit busier again.
It was early March that Monklands took its first COVID patient. Experienced medics had to learn about a novel virus while patients were on life support in front of them.
I've been an ICU nurse for about 19 years now, and this is so different to anything that we've seen before. It's kind of working way out with our normal, as I say, comfort zone is the only way I can describe it. We're working way out of anything that we've ever really seen before.
There's a lot of things about how we thought COVID would affect people, and we've been playing catch up to an extent, almost seeing what works and then adapting around that. A lot of the plans that were in place were on the assumption that this would act like flu. That really hasn't been the case. There's been a lot of extra pressures on things like kidney support and renal support, and we've had a lot of help from our colleagues in the renal department to help with the degree of multiple organ failure that we didn't anticipate, really.
I think about a third of our coronavirus patients in intensive care also had quite significant renal dysfunction, so they had to be on a dialysis kidney machine for a long time, and that often then continued after they left intensive care.
Monklands is now reporting new and unexpected problems in patients who've recovered from coronavirus. There are unusually high rates of kidney failure and a brain condition called delirium. Sean was on a life support ventilator for almost 2 weeks. Before coronavirus, he was fit, had an active job as a joiner, and had no underlying health problems. Now he's relearning to walk, and he's on dialysis.
Losing the loss in my legs as well, that's been kind of a major thing. Exhausted, sore head, dizziness.
You're now on dialysis?
Yeah, coronavirus is kind of affecting a lot of people's kidneys at the moment. And I'm still not sure what's wrong with mine as well, so I just try to get to the bottom of it now.
That's just part of the learning curve for this virus and the recovery.
And it's definitely not been an easy ride anyway.
What's been the hardest part?
Probably I've been away from my daughter for as long as this.
How old is she?
She's 1. Still 1.
What are you looking forward to most when you get out of here?
KFC.
And a hug from your daughter?
Had that as well,
After the KFC. The team here is learning more about coronavirus from patients like Sean though, and this knowledge is helping them push back.
We have come from a point of knowing a little bit about very severe cases and then learning a little bit more about the less severe cases, and we've begun to really see a much wider spectrum of disease, and I think that's something that's really dramatically changed, that we've begun to understand how this disease presents itself a little bit better than we had before. There's been some reports obviously in the paediatric cases and things that may be associated with it, but I think it's still quite an unclear picture of that for the moment, and I don't think that we've got a lot of certainty about what the long-term complications and what later complications might be.
Is that all the more reason for us to not let our guard down on coronavirus?
Yeah, absolutely. I think that one of the things we've got to understand is this is a very dynamic process, this learning about coronavirus. We really are having to learn about things as and when they come up. There's a lot of learning as we're going along. What we haven't seen in the world before, perhaps on such a large scale, is a virus that is so infectious with such a high risk of death to people and serious sort of life-threatening complications. And I think that that's something that it's a real difference from things like Ebola, where there's a high mortality rate, a high death rate from it, but actually it's not quite as infectious as this.
The infectious diseases ward is where the first COVID patient was seen in Monklands. Much of the learning about what worked and what didn't when treating this virus stems from here.
We are prepared for a second wave should there be one. In March, when we had to reconfigure services very quickly, then we had to get to a place really overnight, where we were able to deliver safe care. But NHS Lanarkshire, and I think probably NHS Scotland, has never been in a position where we actually felt we were going to run out of critical care capacity.
Have you had a temperature?
One of the key tools the Lanarkshire Health Board used to stop hospitals being overwhelmed was the creation of COVID triage in their community health centres. Anyone showing COVID symptoms still dials 111, but instead of being sent straight to hospital, they come here first for a physical assessment.
I don't have to go to hospital, no.
Not now. Is that some relief to you?
It's very much a relief, yes,
About 60% of patients are deemed fit enough to recover at home, making sure hospital beds are kept available for the most sick patients.
All right, okay, you take care.
Thank you very much.
So that's somebody who we've managed to see in the community today, get them home with appropriate treatment without them having to be seen in one of our emergency departments.
And given he's someone who's shielding, it would have been potentially risky to be in a hospital environment.
Yeah, it's ideal if we can try and keep people in as controlled circumstances as possible, and with our infection control processes here, we try and keep this as safe as an environment for everyone, whether they're shielding or not.
The Monklands Hospital building itself has also been adapted as more was learned about the virus and how it can be carried from room to room.
We've seen this even in the supermarkets where they have one-way systems. So we had to develop a one-way system in the ward in terms of how do you put on your scrubs and your other PPE safely, and where can you take it off in order to ensure that you're never contaminated. And of course if we become contaminated, then we're at risk of contaminating others. So it's a really important part of good patient care.
This is just a short-term redesign of one hospital with COVID red zones and non-COVID green zones. But the Lanarkshire Health Board was already at the design stage for a brand new Monklands Hospital building due for completion in 7 years. Coronavirus now means going back to the drawing board.
We probably need to think about capacity planning, what our bed base looks like around, dealing with any future pandemic or dealing with this particular virus. So,
and wider corridors.
And wider corridors, yeah.
Digital consultations and online family visits are part of the rethink for what a post-COVID hospital might need. But in the short term, having coronavirus deaths without relatives present has been part of the learning curve here. These ICU nurses prepare end-of-life care packs for families who can't be here in the final minutes.
So we have the paperwork required here in this top drawer, and then in here we have a wee tree and some inks, different coloured inks, and what we do is we take some fingerprints from the patients and we put them on this tree, and then afterwards we send these out to families. We're hoping that this is going to be received well by the families, and this is just a wee gesture from us to say that someone's been here with their loved one and someone's been sitting there and someone's been looking after them at the end when we know it's not possible for the families to be here.
This is actually something the hospital has not asked for. The public started sending these in knitted love hearts. One of them stays with the coronavirus patient when they pass away, and the other love heart is then given to their family who could not be here with them when they died. One of Scotland's biggest problems in this pandemic has been shielding the elderly. Care homes have been devastated, and the Scottish Government suspects some cases are linked to patients being sent into care homes from hospitals and then seeding the virus. Now, before any elderly patient is discharged, they must give 2 negative tests. Staff in this ward are now a first line of defence for care homes.
A lot of our patients have deliriums, dementias, so trying to swab somebody and explain what you're doing, it's not nice for them. It's not nice.
How do you do it?
Usually just talk to them or get them to do something, take their mind off it, tell them it'll be as quick as we can possibly do it. It's something we have to do to try and capture these numbers.
Staff here have learned they cannot depend on testing alone though.
Testing has been important, but we know that there are a number of tests that come back negative and falsely, in fact. Perhaps up to 1 in 10 can be that way. So therefore we know also that people can be asymptomatic but still be potentially passing the virus on.
The protective equipment that keeps staff safe here has also been a burden when it comes to the urgency of trying to save a life.
Of course, if you have to get on PPE, which takes a few minutes, all the time that you're not doing CPR for someone, reduces their chance of survival and coming back from that cardiac arrest.
That's just been something you've had to adapt to.
Yeah. I found that quite difficult actually, not being able to immediately help someone who's in need.
What do you think you've learned?
The NHS as a whole is understaffed, underfunded, and I think this pandemic has brought that again to light. It's brought that to everyone's front of their minds, so I hope that will continue to improve as the pandemic evolves.
As the pandemic evolves is the thinking here. No one talks about coronavirus going away, not yet.
And I think we're progressing every day. We're getting better, we're knowing more, we know how to react to these patients, and we're just all getting better as a team. So that's how we're getting through it. It is getting a lot easier.
People are talking about, is there going to be a second wave or a third wave? Do you think we're better equipped to deal with that?
I think we are now. I think the knowledge that we've got and the experience, we're looking after the patients who've been so ill. I think that we're better prepared now. If we did have a second wave or a third wave, we're better prepared.
Every ward here has staff who say the last few months have been their worst. But in dark days shared with colleagues, they've also seen the best of humanity. From the student nurses who came in to help, to the most experienced nurse in the hospital. Susan completed her training in this very ward back in 1978 and was due to finish her career here. But coronavirus also changes retirement plans.
So I'm actually due to retire next Sunday. So that will be me finishing my career, 42 years. But what I'm going to do is I'm actually going to come back and work a couple of days a week to help my staff in my hospital fight coronavirus.
You've made that decision, you don't want...
I've made that decision, so that the decision is, yes, come back, get us over this period and go out in a high.
You are one of these NHS heroes we hear so much about.
Oh, I don't know. Never seen myself as a hero, and I think we do a job and that's what we're trained to do.
The first peak of coronavirus has passed, but no one here is celebrating. They're tired, and there's something of an acceptance that they will need to go again. But they've learned from their good days and from their bad. And if a second COVID wave does come, this time they know what to expect, and they are ready. Peter Smith, Monklands Hospital in Lanarkshire.